it's stakeholders time. So indeed, the rest of you, it's listening mode, but also taking notes and asking questions and trying to get into an exchange, lively exchange afterwards. We will have Heidrun first, Elke, and then Annemie, who will actually try to answer the following questions, just to put you in the context. First, given their experience and their work, you remember the tour de table. Are the issues or topics covered by the redline document adapted to their work, daily work? If not, what topics are missing? If yes, what will be the priorities? Also, what should or could research address more in this redline document? What policy could make concrete use of? Also, we would be very happy to collect some good practices and examples. Of course, the links as well. This is very important with policy priorities, with the European Commission, the international agenda, and so on. Also national priorities, but just to really put it in a global, in a broader context. And of course, one important question, will you, a stakeholder, use the result of such research? Thank you, and Heidrun, you have the floor.
Yes, thank you very much. So the first question was, are my issues or topics covered? And I must say, this document, this redline document, is really very comprehensive and covers most of the questions and the most important issues. They are also important for our member organizations. And what we think is most urgent is the general attitude towards older persons, the question of ageism. But we have to know more precisely what kind of ageism do we talk about and which one has the most, the worst impact. Is it ageism in general? Is it generalizing attitudes, as for instance the call to all older people older than 65 to stay at home and so on, what was already mentioned? Is it the paternalistic attitude? We have to care for you, you are suffering and you cannot deal with the problems yourself, we have to protect you, and so on. And what I think is most ageist is not asking the older persons themselves, making decisions without knowing what they want, what they need, what they feel. So this is one of the most important things, I think. Then I am missing in the document that does not show how older persons themselves will be included in the inquiry or in the study. It should be in the end. So this should be made clear. How will this happen? And it's the question, what are the reasons behind differing outcomes? I think I'll explain this more in detail later, what I mean by this. Yes, the first one was addressing the perspective of older persons, and then investigating the reasons behind different outcomes. I picked out just two research questions of the document. One was, did increased ageism contribute to more isolation and loneliness? So again, I asked, which kind of ageism are we talking about? By whom has it been exerted? By governments, by neighbors, by family members, by municipalities? So who is behind this ageism? And how was the impact on really old people and older adults, on people living lonely and isolated, on people involved in a large and very satisfying and lively network. So this is what you said in the beginning about the heterogeneity of aging. So this should be made clear here. And another question I picked out was the impact of the COVID-19 on isolation, loneliness, ageism, and care differences different among countries? I think we know it was different. But again, the question, what is this difference? Why is it so? What are the reasons? And what are the reasons for different outcomes? I think this is very important to learn how to implement new instruments. I think Bruno mentioned already in his introduction that he is interested in what factors are decisive. This is exactly what I mean. Looking at the reasons behind and the impact factors. So, next slide. What should or could policy make concrete use? First of all, they should make use of everything which is already known, because there is already a lot of knowledge around. Just two examples. A study made by Eurocarers, a very comprehensive study, which presents targeted survey about what older persons are suffering or not suffering. And the other is a very broad German study initiated by Society for Rehabilitation. They developed questionnaires and sent them with the help of stakeholders of different parts and different disciplines to stakeholders, to health and care insurances, to NGOs, to the organizations of care providers. So this is a very, very broad study with broad answers, which can be used if policymakers want to use it. Also easy to read in German, of course. Sorry for this in this case, but just to show there is already a lot of knowledge around. And then, of course, policymakers should make use of what any further research shows. So, and you asked for good practices. I made only a small collection of good practices, which I found at the Age Platform website and at the Baxo website. It's very good examples already made or projects made before the COVID happened. So we have a long tradition of looking at loneliness. And for instance, in Germany, we gathered good practice examples and published a brochure about it. Then we have recommendations from WAVE, the Women's Against Violence Europe, or the European Social Union, Seniors Union, sorry, European Seniors Union. They formulated recommendations as well. So you have a lot of good examples. Here, just a few of them. I can send you more if you want. So, and then the link with policy priorities. All the topics are linked with both Age platforms and Baxo's vision to voice the interests and needs of older persons. We have made a lot of press releases, of statements, of position papers on the different issues already during the last 1.5 years. And we will continue doing this, of course. And we also use already the results of research. And in addition to this, the experience is made and documented by our member organizations. We continue to ask our member organizations, what are your experiences? What do you think is necessary? They tell us, well, there is a lot now on older people suffering in care institutions. But don't forget the families, the family caregivers. Don't forget the caregivers from eastern parts of Europe who do a lot of care in Western European countries. So these are then questions we think about, and we try to find solutions and to formulate recommendations. And of course, this is my final statement, of course, in case you find good results and can give good advice, we will use also this. And perhaps something which came to my mind today, I did not mention it here, but what I think would be an important question, we don't have a lot of knowledge about this until now, is how did feelings of loneliness and problems in caregiving, how did this develop during the last 2 years? You know a lot from the beginning. You know there was a lot of resilience among older persons, but this resilience lasts even now after the third and fourth wave? Or has it changed? Or have some adaptations taken place? Or did loneliness decrease because people were more adept now to use digital devices? Or what has changed in institutions to make it easier for people to come together? So I think this development, such a follow-up approach would be quite important and interesting, because I don't know that something like that has happened till now. So thank you very much for asking these questions, and I look forward to know more about it. Thank you very much.
I'll now pass the floor to Elke, please.
So first of all, I come from the practical point of view, being employed by Baxo, but being also a member of a huge cross-border cooperation about loneliness. This cooperation is led by the University Maastricht. So there is an enormous study going on about research results, but also studies in our 3 countries. It's about Germany, Belgium, and the Netherlands. So we are in concrete contact and also can see how different the measures in our countries are for the moment. It's not the same, it's totally different. So first of all, to the question, are all the issues we would like to have information in? We come from really a practical approach. We would like to develop guidelines in our program about effective interventions. We would like to have effective practices. We are looking for practices in our 3 countries that are able to be maybe also used in other countries. So I would say there is a lack of successful approaches in crisis management and targeting for vulnerable groups. We need more criteria. What is a good example? We need family carers inside our programs. Heidrun was talking about the position papers of our organization, BAXO, there is one very interesting related to informal caring, where it is pointed out emergency care must be provided. We are looking to emergency teams. This is a key word, but really important. And to maybe short-term care services that are not existing. There is a lot of initiatives we are looking for which are not existing yet and where BAXO is calling for, especially when it comes to informal care given by families, care supported by volunteers, all around this topic. So you have this comes from a position paper I do think in 2020. So talking about emergency care, emergency teams, short-term services that are not available any in our country. So what should or could research address? I think there is a need to focus on higher risk population facing multiple forms of vulnerabilities. This means people that we have talking about that financial issues are a problem, poor health, special health problems, living in bad housing, not living in a rural area, no access to internet, and this is I'm talking about those who have not only one problem but a lot of problems, and so that maybe are more in danger to face also loneliness. I would like to have a focus on success factors coming from the more practical point of view. How to design community-based services for people with care needs, for family carers. We need really clear messages. We think also, or I think also, I think Heidrun was talking about it also, all the measures to be developed in the community should be accompanied by participation of those who are affected by loneliness, including those who are really far away from being part of the society. What we also miss is me personally miss is an intergenerational approach, because many people have started small initiatives, also younger people have done it. So it would be nice to have a more clear picture what has happened during all the crisis time of crisis. I saw some nice examples of strategies at city level to inform, not only to inform people, but giving advice. What could you do? What could you use? Is there any help available in our city? A comprehensive guidance for people in need of help. When it comes to crisis, it's not only Corona, it's also other crises that people face. And I do think there is not enough services in one hand available for older people in need. What could policy concentrate of? I do think that all the work, and including the work we are doing together with this partnership with Belgium and the Netherlands, can contribute to develop a new policy and to give advice to politicians from the perspective of an NGO representing older people themselves. I do think that your work in more related to demographic problems, but also covering the same topic, the results from COVID research and older people and loneliness could have an added value to our project, to the researchers in Maastricht and also in Liège. There are also researchers that have a specific look to education in this field. This means they would like to know which kind of advice and education is needed for professionals on one hand, but also on volunteers. There is a lot of volunteering in our country during this crisis, after this crisis. We would like to have a better input. When it comes to practices, there is one very nice practice in Germany from one of our members. It's from the Malteser. Malteser is existing in many countries, also not only in Germany. It's a huge program financed by our Ministry for Family and Youth and Seniors. The project is primarily intended to finance the development of new routes to older people and to very old people, a very important target group, as well as the expansion of voluntary visiting services. Voluntary visiting services, this is what we know, are very prominent in all our countries. This is where people visit older people at home to combat loneliness. It's not new, but we are looking for special new ideas in this field. The Malteser have implemented or are going to implement new forms in more than 110 locations in all our federal states in Germany. So it will be very nice to have. I think it's running until next year or the year after. Nice examples, nice practices coming from this huge program. Then we have in our program about loneliness with the partners in Belgium and Netherlands, we have decided to have associate partners, which means stakeholders from the local communities, from cities in our areas. So we had a talk with our associated partners and they had these questions you are looking for. One of the questions was, how can you avoid that volunteers disappear when a crisis comes? How can you avoid that older people in loneliness are not willing to accept services from outside? What they did in the Malteser, for example, it's a good example really, is to think about new services, may it telephone visits. This is very popular all over Europe, I would say, but also new forms of shopping together, new forms of visiting cultural events when the door was open to culture. And what is exceptional, I would say, is they were able to recruit new volunteers. So on the same time, we had the impression volunteers decided to stop working as volunteer, but at the same time, there are new volunteers, maybe being in pension now or whatever the reason is, that start volunteering during the crisis. It would be very nice to have more reasons how can this happen, and to have a look from the point of research about this time of crisis, what has happened to volunteers and why. Yeah, here it's again, I summarize here where we are active. Mrs. Mohrenkopf is highly active at international level and also at a European level. But within our programs, such as the program I was talking about, for example, a profile program with Maastricht University, we look mainly to practical approaches, and also to look, it's easier when you have only 3 countries to look to cultural differences, to look to maybe they do the same, but in another way, with other partners or with a broader content in it. It's quite interesting to also fund such kinds of programs so that people can not only look to their own country, I mean citizens or senior citizens, that they have the possibility to look to other countries. I would say it's very important. And this is the reason that we have big conferences and also new formats on bringing people together to learn from each other, not only those who are classical stakeholders, but also normal citizens. And the idea also in this project is that we bring together young and old. This is, I would say, a preventive measure also against ageism, so that they learn what is happening with older people, and the other way around, that younger people learn what has happened to older people, especially during the crisis. We hope to have nice events. It started I think 8 months. We are expecting research results in the end of next year, and we also develop many guidelines and maps of practices and so on until summer 2023, I would say. So everything what is coming up from this research, from your research, would be very nice for us, not for me especially, but for the researcher that are collecting everything all around this topic, also including what has happened during the Corona crisis. So thank you very much for your attention.
Last but definitely not least, Annemie, we have 20 minutes to discuss COFAS's opinion. Thank you.
Okay, thank you so much. And thank you also for the colleagues for their interesting opinions and sharing their knowledge. I represent here, as I said, families, and the COVID pandemic has hit all families very hard, and mostly the huge impacts were for families in vulnerable situations. Families in vulnerable situations are not only poor families, but also families with a lot of care duties. And we are very happy that the redline document put the focus on the important role of informal care, of family carers. And also there is an interesting focus on the urgent need to develop community-based services as a paramount to meaningful inclusion in society. And
excuse me, Annemie, I was just wondering, don't you have slides?
Yes, yes,
slides.
Denise.
Do you want to put them, or Denise can put them for you?
Could you? Yes.
Denise, you're muted.
I need help from Denise to put my slides on.
You need your shares now, Annemie?
Yes, if possible,
Okay.
yes. This was an intro, so
Okay.
so you have time. But I can maybe go on. We are one of the founders of an expert group on the DI, the deinstitutionalization. And so this topic of community-based care is very interesting for us. It is not.
No, it just went somewhere I didn't want it to go.
Okay, so deinstitutionalization is a difficult word, DI, we could say. It's not only about closing down large-scale residential institutions, but it refers to a whole process of putting inclusion and respect of human rights at the center of all policy, from birth to old age. And COFAS, as I said, is fighting for an inclusive society, so also for the elder people. And we are in favor to use this crisis, COVID crisis and economic crisis, social crisis, to make a major shift a shift towards meaningful inclusion in Europe. And this is also in the redline document. There is a request to reinvent care to research in the research question. So I just like to show you the shift because we focused with this shift. We did the exercise for people with disabilities. I do not say that you can easily compare elderly people with disabled persons, but there is a link to be made in our opinion. So the shift guide, it's very clear from the slide. So you see the 5 objectives: the support, human rights, independence, families, and transition. That are the objectives of our action. And it is our vision that is represented. And we represent also 15 tools to reach those objectives and the actions. I will not go through all of this, but keep in mind during my presentation that this approach is easily declined in various areas of life. And it could be, maybe it's an invitation, it could be useful for the elderly people as well, because the shift is really aiming at meaningful inclusion. And that's exactly what we are tackling here, because people who are lonely and excluded, they feel very excluded, as I said. So I will not go into detail, but I like to show you the support. That's the first principle. It's the support of the sector. Here it is disability, but as I said, it can be transferred to the aging persons. And what is important is that we here, based on research, we ranged a kind of tools and actions that addressed the disability sector. And the principles you see here, also the tools are the person-centered approach, which is very crucial. We need a co-production in the sector, so people should be involved in the whole caring process. And we need also targeted support. That is about the support. Then the next slide, please. You see that the second principle is human rights. Here we can find actions and tools to ensure that persons, elderly people or people with disability, are aware of their rights and that they can exercise them fully. And what is important there, the tools are information, assistive technology. We should harness the potential of assistive technologies. And it is also important to monitor the rights and make sure that complaints are available, procedures. On the next slide, you see that the I stands for independence, independence living. And this is the third principle. It is about reshaping the mainstream sector in a fully accessible way, so that persons with disability have access to all services. And therefore, we need actions, training on inclusion for the sectors, reasonable accommodation and equal access in education, employment, to remove barriers from birth to old age. And we need also partnership. It's a very important tool. Build bridges between the person you care for and the actors, the professionals. So then we come to the fourth. That is the families, empower families. So this is very important for us. And also in the discussion that we have now, we think that families need to be empowered so that they are included in families and that they really felt supported. In family, we already highlighted the importance of the family carer. And this is really crucial that family carers, particularly during this crisis, are recognized. We have seen that in many cases, they help to survive people, the informal care, the family carer. And it is for us also very important to reflect on the family carers, on the social status, on their rights, and that should be also a priority. What can be done? What should be done? It's also a research question, I think. As tool, we see early intervention and support as very important tool. The family planning and parental support is naturally specialized for persons with disabilities, but you see, you can imagine other tools important for family carers caring about elderly people. Here, the focus is more on, as I said, on people with disabilities. And last but not least, we reached the T, which stands for transition. So with this guide, we want really to make the transition and to embrace inclusion as a core principle, promoting equal opportunities for all people. And therefore we need to mainstream here the disability, but also across all policy areas. We want to raise awareness about the benefits of inclusion. And we want also regulation on equal participation in all areas of life by reinforcing the anti-discrimination. So after this process, the build of the guide, we launched a campaign to collect actions because we want to make it concrete. For policymakers, it is very important that they see that things are already happening and they cannot deny this reality, I would say. So if you want really to encourage policymakers, that's our experience, to handle and to tackle a topic, it is very good to give them inspiring practices, to inspire themselves and to make this happen. And the shift towards inclusive societies for persons with disabilities is, as it was shown in our guide, it is not a dream, but it is our shared responsibility. And we were very happy that with the campaign, we collected 45 actions, practices, real life examples that the shift towards meaningful inclusion is happening. And those examples are very rich and very spread all over Europe. So, and our wish is that, this shift atlas, we call it, the next, this publication, could encourage people to join this shift process and to think when they are researching or where they are making a proposal to the Commission recommendations, to use this approach by this, the 5 letters of shift. And we really want to join you in your research and to maybe we could together build such a shift for elderly people, so to ensure that the loneliness is tackled based on this support, human rights, independency, family, and transition approach. So this is what I wanted to share with you. It is a knowledge sharing process. So we wanted really to bring in our experience and see how your research could fit in building such a guide with concrete actions that we could help find out with you, focused in the case that we are discussing today on not on disabled people, but on people, older age people, loneliness, and so the target group we are discussing about.
Wow, it's an impressive guide.
We hope together with you to make the shift and to tackle the loneliness and the inclusion. And all of this is a very short rush through a very interesting guide. I would encourage you to take a look at our website, and also the last publication was fully supported by the Commissioner Dali, who is Commissioner of Equal Opportunities, and by Commissioner Schmidt. So both commissioners are aware about this shift that we want to push forward. And I would be happy if together with GPI, we could shift also for elderly people and build this kind of guidance. But we need your help for the research. And as I said, the shift guide for disabled people was also built on research from experts looking at the disabled persons. So that is it. It's open for reflections and.
Thank you, Annemie. Thank you. Very interesting guide.